Hey there, Dr. Alan Christianson here, and I'm really jazzed to talk to you today about the Apoe genotype. So this is an important thing, and it's critical because it shows ways in which people have different needs, and in which some habits, some diets that may be okay for some are harmful for others, and also ways in which we have obvious differences for our genetic disease risks. So there's many gene correlations we're aware of, but a lot of them are not that significant, and there's more we have to sort out with them, but this is one we know quite a bit about already, and it's good to be aware of it. So what does this do? Well, this affects the size of our chylomicrons, and that means it changes how we metabolize fats throughout our body. That's true for our bloodstream and also within our brain. So fats and cholesterol are transported and metabolized differently based upon these chylomicrons, these fat-carrying substances. And the Apoe determines how these microns form from person to person. So there's different forms of this genotype. There's different alleles. There's the 2, 3, and 4 allele. And we all have 2 of those. So you can imagine different combinations. Now the 2-2 and the 2-4 allele are possible, but they're not probable. They're actually so exceedingly rare that we can leave them out of our current discussion. So we're going to talk about the 2-3, the 3-3, the 3-4, and the 4-4. They're the most common ones by the vast majority. And of those, the 2-3 and the 3-3, especially the 3-3, are the most common ones that we see in populations. This varies a little bit based upon ethnicity, but overall, that's most typical. The 3-4 is roughly 20% of most populations. A little bit higher in, I believe, Nigeria, it was as high as 30%. So some pockets will be up a little bit, but typically around 20%. And then the 4-4 is the rarest of that group, and that's roughly 2% of most populations. So the 2-3, roughly 10-15%, and the vast majority of everyone else is 3-3. So if you're 3-3 or 2-3, you've got a lot of options for your macronutrients. You can honestly do pretty well on low carb, low fat, mixed type diets. You could pick or choose and have relatively good health effects. You're not as vulnerable to the effects of dietary cholesterol or dietary saturated fat. And you can have fat overall be 1/3 of your calories, 40% of your calories, probably do fine. If you've got the 4 allele, however, things are different. Your body cannot transport fat as well, and you can't use it for fuel as effectively. This one first became apparent in terms of Alzheimer's disease risk. Those that have the 4-4 allele, the 4-4 genotype, I should say, their risk for Alzheimer's may be 20 times greater. I've seen different numbers, but that's one of the more dramatic ones that I've seen. They are the ones really highly at risk for Alzheimer's. Those with the 3-4 are at 2 to 3, perhaps even 5 times the risk of the general population. So more of a factor for them. The others, they still can get it. They're not avoidant of risk, but it is just more typical. And a lot of these numbers also follow for heart attack, stroke, diabetes, and obesity. They're all things that are worse for those that 4 genotype. Now, I'm in that category. So I'm not the 4-4, thankfully, but I am the 3-4. And I was adopted, but I've met many of my birth family, and my birth grandfather did seem to have some signs of Alzheimer's type dementia. He was, I believe, in his 80s when it manifested, so not quite as unusual, but that is there. So I've been aware of that. But this 3-4 genotype affects it. So for some time, in terms of genetic testing, this was actually a big consideration, is that, hey, do you want to know? And places like 23andMe, for example, for a while, they would not disclose this because there was a lot of just informed consent issues about giving someone that heavy possible diagnosis, especially those that 4-4 genotype. And before you were to pursue with testing this, if you were to choose to, I'd highly encourage you to think that through. You know, do you want to know? Personally, I think it's nice to have information and be informed and take action. There are others who would prefer to live their lives and not be aware. Respect that. but just know that you can't unknow something. So in terms of how to find this out, well, there are options. There are regular labs that can do tests that show these genotypes through blood tests. By and large, however, this data is less confidential. So if you do want that to be of public record, that's a route to do it. Typically, those end up not being covered by insurance. You know, I tried this route before for patients who wanted to say if their insurance would cover those tests. They often would run them through labs that could work with insurance, but they'd get billed anyway, and it was often $500, $600, $700, so not helpful. If you do choose to do this, probably the most effective, cost-effective fashion is 23andMe. I have no financial ties to them, but they have a good test, which I think now is $199 or $129. It's been always about that ballpark price, a bit lower in the past, but I don't think you see it higher than $199. The nice thing about that is it's a very thorough repository of genetic knowledge. There's hundreds of thousands of genotypes that they analyze. They give you a fun report about your ancestry patterns, and they give you some health information again nowadays. They've been back and forth about what the FDA will allow. The drawback about them is you've got to do legwork. So they don't just tell you, here is your Apoe genotype, here is your MTHFR status. No, but it's not too difficult. So in the article that I've written to go along with this, I walked you through the exact steps and the codes and how you access your raw data and get under the hood, so to speak, with your 23andMe findings. Another bad thing is that I did my test quite some time back, and so maybe this is different right now, but the feedback I've had from others in the recent past is that the turnaround times are unpredictable. You know, you may get your results in a few weeks, it might be several months. So maybe a bit of a message in the bottle, but probably the most effective version still. So when you know your genotype, well, what's relevant? Well, a couple things are. One is head trauma. And this has become really on the radar and very cognizant amongst those in organized sports, thankfully, organized contact sports. I've been told that amongst the NFL, they screen for this genotype because those with this 3, 4, and 4, 4, the same way we're prone to brain aging, we're also prone to more severe effects from concussion. So people that have those, there's guidelines on if you have a concussion, you're out for 10 seconds, you must sit out 2 games. I'm making that up, but there's guidelines along those lines, and that those that have this genotype, it's all amplified. So say they have a 10-second concussion, maybe they're out for the season. So again, I'm making up the numbers, but the idea is that whatever head trauma they get, if they have that, they're given more dispensation. They're given a greater leeway and more time to recover. And there was even a group for a while that had a similar test available for young athletes. Oh, and I should say, most gene tests are salivary tests. So you're spitting into a tube, you're spitting onto a little Q-tip, something along those lines. You know, you hear about crime scene studies. Any cheek cell has your full genetic code. So your saliva always has some cheek cells. So they're very non-invasive tests. But this was a test that was done for young athletes who were in the earliest levels of contact football to see if they should even be doing this as a long-term sport. They showed that those that had the Apoe4 genotypes, they had a much higher risk of severe brain injury from minor concussion. So that's one consideration. If you've got those, you don't want to get your bell rung too hard too often. Other considerations are dietary fat quantity and dietary fat quality. So quantity, the 3, 4, and the 4, 4, it's more imperative to be lower fat. And based on how the body works, you're probably going to be more metabolically efficient being lower fat. Now, what do I mean by that? As always, it's in the details, right? So there was a while to where low fat was the rage, and then we had to double down and go fat-free. No, we need fats. Fats are good. Carbs are good. Proteins are good. Food is good. We need food, and we need different types of food. So there's essential fats, omega-3 and omega-6, that without our bodies lack nutrients. There's critical things we need for chemical reactions. There's a lot of non-essential fats. Most saturated fats, most omega-9 fats, they're not essential. They're things that we do not have to acquire through our diets. They are things that we use chemically, but we manufacture them if and when and how much we want them. So the thought about that is not fat-free by no means, but lower fat, and really prioritize to focus on fats that have these essential fatty acids in them. not the ones that have empty calories per se. So how low is that? Well, I've never really seen data arguing that you're going to get in trouble being lower than 20% calories from fat. And that's rather low fat. That's not a lot of fat in your diet. Personally, I stay about there. I seem to do best for a lot of ways. What that looks like is half of an ounce of nuts or seeds a couple times per day, maybe a tablespoon or so of things like flax oil or olive oil throughout the course of the day, fatty fish pretty frequently, some avocado here and there, but really not much other fat, not high quantities of it. Ends up being about 20% of calories. Having said that, you're probably fine up to 25 or 30 if you've got that 4 genotype. 30 is questionable, 20, 25 is probably the sweet spot. If you're not with that 4 genotype, you've got more leeway. You're probably okay 40, 50% of calories. I wouldn't go much higher than that because there is data saying that regardless of genotype, when there's too much fat, that starves your good flora and you start getting compromises in the integrity of your intestinal flora and other problems too. I've written about pitfalls of going too far on low carb, which ends up what's happening when you're getting more calories from fat. Protein needs are more consistent from person to person. We all do great with somewhere around a quarter or a third of our calories from protein, but it's the protein, it's the carbs and the fat that we can change back and forth based upon our tolerances. Another big distinction is alcohol. The data is strong that with this 3-4-4-4 genotype, also more vulnerable to the effects of alcohol. So less of that, the better. Back when we were told that alcohol helped us and improved our health, and it turned out that was kind of an optical illusion. So a lot of the old studies that showed, they would look at, here's your death rate, here's your alcohol intake. And those that had no alcohol intake had the most death, not the most, but they had higher risk of death than those that had a low to moderate alcohol intake. Then those that had a very high alcohol intake had more death over here. So looking at that at face value, you'd say, oh wow, the light to moderate drinkers were healthier than the non-drinkers. They had lower rates of death. But then some researchers started to question that data and look at it more in a more granular level. And what they found is that amongst non-drinkers, there's 2 categories. There's those that just choose not to drink or prefer not to drink, and there's those that really can't be drinking. So this group, it means those who have had liver disease, or they've had alcoholism in the past, or they're on medications that they cannot consume alcohol with. Now, everyone in that group is inherently not as healthy as others might be. They've got some health problem, which means they really could not drink. So they get lumped in with those that choose not to drink, but could if they wanted to. But they've done some really clever ways to separate those groups. And those that choose not to drink, but could, actually are healthier than those that drink a little bit or a moderate amount. So when you pull out those that medically can't drink, now there's a straight line of mortality and alcohol intake, where the more the worse. So overall, there's no net benefit. For most people, being on the low part of that, a serving or so a day, is not a big spike in mortality. It's higher, but it's not much higher. So if you lack that 3-4-4-4 genotype and you choose small amounts, no big harm. Focus on things that may have some benefit as far as polyphenols or antioxidants. But again, you could get those from grapes, or you get those from pomegranate just fine. So great thing to be aware of this. I would encourage you to, if you've not, do a 23andMe. Their price point may go up in the future. I don't know. They've gone up a bit in the past. But it's a great way to have data. And we're only learning more about our genes and our health. And when you've got access to that, you can just go in any time when you hear about a new gene and dig in the raw data, know your status, and act in your best interests. So take great care, and we'll talk again really soon. Dr. Christianson here with you.